So we've been using the Itero scanner in our office for almost a year now. And what the Itero does is it can replace taking typical putty impressions of teeth after we prep them for crowns. But we have a patient here who needs a crown, and she's a wonderful patient that has been through all of the putty impressions before in the past, and she's excited to see this new technology also. So the lab takes this digital scan that we send them, and they mill and make a 3D model based on that impression that we send them. In the past, we'd have to send them this putty impression. Takes a day or so to get there, and by the time it gets there, the patient's already long gone. And so they can see this information almost immediately and communicate with us. And so it improves our communication with the lab, the patient experience, and the outcome of our case. Right now, I'm scanning and I can see all of the other restorations in the patient's mouth. This is a clear enough picture that it can show us any other cracks that we may see or older fillings that may need some work on them. This is all a part of the digital impression. We're taking a full arch scan here, but the full arch scan is also used for our mouth guards and also for Invisalign cases too. It's really fun because my assistants are actually a lot better at taking these full arch scans than I am, and so it's really fun for them to be engaged in the process too, even more so than they already were. And the patients are seeing things that they probably wouldn't ever look at on their own, and to not have to go through with all of the gaggy, gross impression material too. So. And that's it. That's your impression for your crown. Done. So now the top arch and the bottom arch and the bite have been scanned. And so the Itero takes that information together and it gives me this picture here, and it shows me the tooth that I've prepped compared to the other teeth around it. And it lets me know if I've taken enough tooth structure off in order to make the kind of crown that I want to make. So everything went really well today with our patient, and we'll see her back here in 2 weeks to submit the permanent crown.